Welcome to Counterpoint, and I am your guest host, Michelle-Louise Simard. On January 11th this year, Quebec Premier François Legault announced plans to tax the unvaccinated citizens of Quebec. The specific details of the tax were not discussed, but Premier Legault was very clear that the tax was not going to be merely $50 or $100. That was insufficient. The tax would have a significant financial penalty. Further, he stated that access to medical care would not be tied to vaccination status, thereby avoiding any issues with the Canada Health Act. Those who had medical exemptions would not be taxed either. As you can imagine, this still caused quite a controversy in Quebec and also the rest of Canada, with many asking, would other provinces follow? And how much would the tax actually be? Legault had opened the floodgates. Comments from experts of different backgrounds have been chiming in on the imposition of such a tax and asking questions such as, is this tax legal? Is this tax ethical? Will this tax put undue pressure on those that are already disadvantaged or disabled? And should this tax be legally challenged? Does this tax create an us versus them division in our society? To answer some of these questions today, we have Dr. Kerry Bowman, a bioethicist and assistant professor of community medicine at the University of Toronto, and Marty Moore, a staff lawyer with the Justice Centre of Constitutional Freedoms. He has been involved in litigation related to lockdown measures and vaccine mandates. Gentlemen, welcome. Whether people like it or not, Premier Legault's announcement of the anti-tax tax has so far proven successful in political terms. Prior to the tax announcement, only 10% of Quebecers were not vaccinated. Within 24 hours of the tax announcement, over 7,000 people registered to get their first jab. According to the Quebec government, the main reason for the tax is that the unvaccinated have placed an oversized burden on the healthcare system and are continually spreading COVID throughout Quebec and Canada. It is estimated that the unvaxxed are costing the healthcare system $1 million a day in Quebec alone. While there are a lot of things to discuss, I want to start by asking this simple question to both of you. In one word or sentence, what was your initial reaction to this announcement?
I personally was shocked. I felt they were going really far. I was shocked.
Yeah, really horrified from a constitutional perspective.
And in either of your experience, we can start with Mr. Moore. Has this kind of law been enacted before?
Not in Canada, to my knowledge, and certainly not in the charter era. We are seeing these kinds of enactments in non-constitutionally based societies such as Austria. I think in Greece as well, there's one of these direct taxes on people's healthcare choices. But in Canada, this is unheard of in a charter era.
Agreed. Dr. Bowman?
Yeah, no, this is a very, very powerful movement, and I see a lot of deep ethical problems with it. It's really the beginning of making judgments about, the behaviors of our patients, which takes us down a road that we just do not do in Canada in relation to the Canada Health Act and ethical practice. Also, I would say that, proportionality is very important in ethics. And I would argue, even from a scientific point of view, and I can expand on this, I'm not convinced it's really dealing with the heart of the problem that we have right now.
And when you say you don't believe it's dealing with the heart of the problem, in what respect? What's the heart of the problem?
Yeah, so, if people tomorrow in Quebec, well, it was announced, so if people have already begun to be vaccinated, remember with Omicron, the Omicron wave is upon us now, maybe has crested, not sure. Those people are, 6 to 9 months away from the 3 vaccines that we are told are the requisite for Omicron. So how effective it would actually be in elevating the amount of people that are vaccinated, I would argue is not really clearly known at this point. Who are the unvaccinated? We don't really understand what's going on in that 10%. There's an assumption that they're all hotheads that we are very angry with, who just refuse to cooperate with the social order. But, embedded in that, I suspect there's some probably strongly muted cultural differences. There's people that are absolutely vulnerable within that subset. So we don't fully know who they are. And to state the obvious, $500 for one person, maybe not a big, I'm making $500 up as a potential sum, maybe no big deal. And for other people, it may mean going a week or two without eating. So really some serious problems with this.
No, I agree. And I think that regardless of the amount, it's causing a burden for those, whether you're financially sound or not.
Yes.
But on that point, gentlemen, we're going to take a break.
Okay.
So, gentlemen, we were just discussing prior to the break the effect this had on the people of Quebec, and those included the disadvantaged and the disabled. So, do you think that the Quebec government, overreached? And I'm going to pass it to you, Mr. Moore.
Absolutely. I mean, this is one of the most egregious charter violations we've seen, and it really harkens back, in my view, to the kind of coercive and dehumanizing government paternalism that has characterized some health interventions in the past. And I recently spoke, for example, with an Aboriginal elder who related how the Canadian government would force the members of his community to line up for medical tests and treatment just for them to receive their annual treaty stipend. And on that community, many of the members of that band, in fact, had decided, based on their own traditions and for their own reasons, not to get vaccinated. So when we're looking at the impact that this tax could have, we need to personalize it. We need to think of it not in the abstract, but how it will actually affect individuals, their rights, and their livelihoods. You know, what kind of a negative effect will this have on the members of that poor First Nations community? And what kind of a negative impact will it have, you know, not just economically, but internally, where it kind of harkens back to this paternalizing, dehumanizing government policy that's really dictating the medical choices of people with their own bodies.
Yes.
That is abhorrent to a charter perspective.
So I would say, would you think that we can characterize this tax as a behavioral or sin tax?
I think it goes so much further than that. It's not just talking about people's, you know, choices with their pleasures. It's talking about people's choices with their own body and medical decisions. And again, the government doesn't know all the reasons or chooses to ignore many of the reasons why people are refusing to get these, whether it's a non-recognized medical concern, whether it's a traditional or religious practice. These are deeply held concerns and realities that people have, and to paint them all with a broad brush and say everyone who's not getting vaccinated must be taxed with a significant burden, it's just unacceptable and, in our view, constitutionally unjustifiable.
Agreed, but at the same token, the counterpoint argument is that, well, what about those who feel that the unvaccinated are causing an overdue burden to the healthcare system and to the rest of society, that the rest of society could be enjoying their lives, going to restaurants and doing the things that they wanted to do, but for the unvaccinated? Would you not think that that would be a good enough reason as well?
Well, I think that's a dangerous scapegoating that's been really played by politicians and some media that's not really grounded in reality. Of course, there's no constitutional right to healthcare. The government has chosen to provide this service. And now this service has been arbitrarily limited. If we look back to the 1980s, Canada had twice as many hospital beds. And so now this arbitrarily limited supply is being the token with which we are coercing and now directly mandating people's medical choices. That is not a justification to violate people's medical choices when the government's own failures to properly staff and requisition for healthcare spaces is really the cause of the problem. And I think the government is really deflecting blame for their own inadequacies onto a particular segment of society, which is increasingly looking like dangerous and discriminatory rhetoric, which is not justified in the science. I mean, we have to recognize, as probably Dr. Bowman can point out much better, you know, the fact is that individuals vaccinated and unvaccinated can contract and transmit COVID. So we're not talking about, you know, the panacea that's going to stop all transmission. We're talking about people who, you know, for better or worse, are going to bear those consequences of their medical choices themselves, and to have the government putting this violation on them in addition, a financial penalty directly for their medical choices, just cannot be stomached from a constitutional perspective.
And I understand that, Mr. Moore, and I'm going to bring Dr. Bowman in. But the point of the matter is that you highlighted a very good point. At the end of the day, to use the pandemic and COVID as an excuse for the hospital shortages that we have is not a very good reason, because we were already having this. And in Ontario, Premier Doug Ford was talking about saying that he was going to get rid of hallway medicine. And hallway medicine was because a lot of hospital beds were here. in the hallway, and people were getting treated. So I understand that point. But there's other ethical considerations to consider. And Dr. Bowman, I'm going to bring you in, but we just make your quick point, because then we have to head to a break.
Yeah. Another big one, and I so often say this, is where did Omicron come from? Where did Delta come from? It came from, the fact that we have a global pandemic that we've done next to nothing about. And what Canada has said we're doing and what we're actually doing are two very, very different things. And so, we have a system that has no resilience within the healthcare. And look, I work in healthcare. I know how hard those systems are. But when you combine the big picture of we've done very little to deal with a global pandemic, our hospitals don't have resiliency, and we're doing this on top of it, I think it's very hard to justify.
Welcome back. And Dr. Bowman, prior to the break, you were talking about some of, we're about to get into the ethical implications in regards to this tax. Can you please elaborate?
Yeah, I mean, the way we do healthcare in Canada is the free and informed consent of the patient, the individual. And look, the individual has never been looked at without a broader context of an individual within society. But this tears at the very, very ethical roots of how we practice within Canada, because you are putting people in a position where they may feel absolutely coerced into having an injection into their body that they do not believe is safe or they're comfortable with. And we could argue, but it is safe and they should be comfortable, but it is their body and their choice. And I think it actually, is potentially doing some serious damage to how we perceive healthcare ethics in this country that may outlive the pandemic itself.
Yeah, I actually agree with you. I think that what's happening right now is precedent setting. And I believe it's precedent setting because, well, as we discussed a little earlier, has anything like this happened before? No, it hasn't, even though our charter is, relatively young, speaking compared to other countries. But I think this is precedent setting because this is setting a bridge for others to follow. And that's essentially what most governments do. And I think it's ironic right now that we're having people in the political sphere making a lot of decisions, well, albeit with help from experts, that are directing how our lives are going to be and taking away some of our freedoms. And to that point, Mr. Moore, I understand that there may be a lawsuit that will be launched in regards to this new tax. Can you discuss that in a little bit more detail and tell us the main points?
Absolutely. Well, yes, the details of this tax are yet to be released by the Quebec government, but the Justice Centre will be filing a lawsuit shortly after it is enacted. And that lawsuit will be based on Section 7 of the Charter, which protects the right of individuals to their own bodily autonomy. It'll also be based on Section 15(1) of the Charter, which provides you with the right to equality, including equal benefit of the law. And what we're really seeing here is a discriminatory treatment of a minority group in society that is arbitrary, and it's imposing incredible disadvantage on people. The Quebec law is not justified. Of course, these charter violations are clear. The government would have the burden of justifying it. When you're talking about a tax flatly based on someone's vaccination status, without regard to whether they have natural immunity, without regard to their actual use of personal use of medical services, that's, again, a very dangerous legal precedent being set as well, because, there are groups in society. What other biometric measures are we going to use to see, are these people using more government services than these other people, and therefore they must be individually taxed based on their belonging to a biometric group of some kind? That is a very concerning and discriminatory fact. So we would be bringing those arguments to the court in seeking a charter declaration against this tax.
I agree, but then going back to that point, I personally, in my opinion, I believe that Premier Legault is he's a politician, and I think that he's doing what many politicians do. They use the system to their advantage in order to achieve the means that they want. And I think specifically, you had mentioned that you will only file an application to the court once the actual act is enacted, and get more details. And right now, it was very clear from Premier Legault that no specific details were given. There was hints of stuff saying it'll be significant fine. It won't be small like $50 or $100, as I mentioned in the beginning. But frankly, at the end of the day, what Premier Legault is doing is that he's using the stick to get people to get vaccinated. And it seems it's proving quite successful. And at the end of the day, he may not actually enact this act, and he might have achieved his goal. And even if he does enact this act, it could be just a Pyrrhic victory, because in the end, if he got the majority of people vaccinated, and regardless if this law is considered unconstitutional or not, he still achieved the means of what he wanted. And albeit, if somehow that doesn't work either, as we know, Quebec is quite famous for having the use of the notwithstanding clause. So in that respect, I look at it as, should have we used the stick or should have we used the carrot? Because perhaps instead of giving a tax, what we could have done is give a tax incentive. Gentlemen, what do you think about this? I give you 10 seconds each.
Yeah, Marty, I'm going to start if you don't mind. Yeah, if it was a ruse, I kind of say shame on him because it's manipulative. And this is not what a leader should be doing. It's manipulative in a very, very ugly and divisive way. And, carrots and sticks, my God, these metaphors are kind of, animal cruelty. Are we really at that point? It's just not necessary. And he may never enact it, but I don't see that as a victory. Quebec is independent. I'm actually from Quebec, and I admire Quebec's independence. But on this one, I really don't support it. I think it's very destructive.
Welcome back, gentlemen. Prior to the break, we were discussing the carrot and the stick analogy. So we're back at it again. And Mr. Moore, what are your thoughts on that?
Well, I think any government that's going to try to dictate people's medical choices is, regardless of whether it's a carrot or stick, they are crossing that charter line, which is the line that says this is not a means you can get, a means you can use to get to an end you want to justify. And that's really a thing that needs to permeate not just the legal realm, but also the political and the social realm of society. Canada, under our charter, is a free and democratic society. That's a broad term. And you know what? The political discourse, the media discourse, and just the everyday conversation needs to be reminded of the fact that freedom of individuals is important regardless of whether you agree with their choices.
Yes, no, I understand 100%. But at the same token, bringing up that point, the counterpoint to that is that, well, what about the other people who one would argue have been law-abiding citizens and have taken their vaccines and have done and have honored these lockdowns? What about them? And what about their rights? Because according to a Mero Group poll, they did a province-by-province poll on what voters think about the anti-vax tax. And in BC, 64% approve. Quebec, 63% approve. Manitoba and Saskatchewan, 61% approve. Ontario, 58%. Atlantic Canada, 57%. And Alberta, 54%. And all provinces, over 50% of the population agree with this tax because they feel it's fair and just for them. What about their voices? Don't their voices get heard?
Well, this is exactly why the charter exists, so that majoritarian preferences in the moment do not trump the fundamental rights and freedoms of Canadians that are enduring principles on which a free and prosperous society can be founded.
Well, that's well said. I agree with it. As a lawyer, I completely agree. This is why we have these type of entrenched rules and protections here for Canadian. And Dr. Bowman?
Yeah, no, I would agree. I mean, I think majority rule, I'll speak as a non-lawyer, but majority rule is a terrible way to respect human rights. And I think that has to be loud and clear.
Yes, and I also feel that the leadership that we're receiving from all the major leaders of all parties has a little bit waned. Prime Minister Trudeau said he received the proposal with interest, but would not weigh on it, saying he needed more details. Jagmeet Singh said he is concerned that the tax would undermine the universal healthcare system in Canada. But again, that's all he said. Aaron O'Toole called Quebec's proposal unfair, predicting it wouldn't persuade those who are unvaccinated to get vaccinated. He said he's opposed to Quebec's plan to target and tax. But really, at the end of the day, this just comes down to rhetoric. To me, it comes down to rhetoric, in my personal opinion, because at the end of the day, what are we going to do? And while we may not always agree with what Premier Legault has done, he has said something that's quite bold. And it has caused a reaction to some people, whether it be good or whether it be bad. And as you had mentioned, Dr. Bowman, we're not sure and we do not know who all these people are who are unvaccinated. That is for certain. There's no survey out there and there's nobody asking specifically, and nor should we, who these people are. But what we are seeing is is that many people are now getting vaccinated, and that's just in Quebec alone. So the question is, do you think it will happen for the rest of Canada? And more importantly, what do our viewers need to know moving forward? Mr. Moore?
Well, I think it would be a very concerning thing to see this go forward across Canada. I wouldn't put it past some other governments. But what our viewers, I think, need to know going forward is that, freedom is a concept that is timeless in its value, and you cannot judge it based on particular circumstances, and especially based on a situation when most Canadians, I think, are not getting the full picture. And the science on this is evolving rapidly. Omicron has changed the equations in many cases. And just give an example. Think of the unvaccinated medical worker in the Quebec hospital currently serving in a very stressed capacity, who's been called back into service after being preemptively fired. And now that person is going to face a significant tax on the income that they are earning for serving even vaccinated people, 50% of them, in the hospital.
Yes.
These practical considerations need to be considered. And these are your fellow Canadians. They're not your enemy. And let's consider what a free society really looks like.
And in one word, Dr. Bowman?
The greatest threat to us all as Canadians is the global pandemic, and it sits largely unaddressed. That is more important than the rest of all of this.
I totally agree with you. Thank you, gentlemen, for your time, and we really appreciate this very important conversation for you coming on this very timely issue. What we gauge from this conversation today is that informed consent is paramount, freedom is timeless, and that this pandemic is not. And we need to be mindful of the decisions that we make moving forward. I want all of you, the viewers, to think about this on the next decisions you make.